Good morning. Myself, Dr. Arti Gupta Tuli, working as Senior Consultant at Fortis Hospital Mall Road in the Department of Obstetrics and Gynecology. Today we'll talk about a very important topic, menopause. Menopause, that is pause to periods, pause to certain female hormones. But you need to understand that this is part of normal biological aging. This is not the end of youth, but this is the beginning of wisdom and self-discovery. So there are certain issues which is associated with menopause. That is symptoms, that is hot flushes, mood swings, inability to sleep in the night, night sweats, एकदम से रात को नींद खुल जाएगी with the sweating, depression, vaginal atrophy, that is thinness of the vaginal wall, so difficulty in having sexual relationship. And if we see the age group in Indian scenario, it is usually seen between 45 to 51 years of age. Talking about these symptoms, when you need to contact your doctor. So whenever some of your friends or you feel changes in the physical appearance after menopause, or you go through these problems, suddenly एकदम से गर्मी लगने लग रही है, एकदम से पसीना आ रहा है, कहीं मूड नहीं लग रहा, मूड चेंज नहीं हो रहा, always feeling depressed. So that is the time you need to see your doctor. And there are certain health screening tests which are recommended that you should go for menopause, because there is a hormone, that is estrogen, which is now stopped. There is pause to that. So certain things which you were enjoying with this estrogen hormone are now not there. So health screening tests are must during this period. For example, what are the health screening tests which are required? First of all, your ultrasonography of whole abdomen. Your whole scenario has to be seen. Second is breast and pelvic examination. Along with examination, there has to be mammography, which should be done, and pap smear if it was not done before. If we talk about blood test, then you should undergo a complete blood count, lipid profile, and your liver function test and renal function test to have a complete view of your different organs, and plus sugar. Because what happens, sugar and thyroid, what happens that women tends to gain weight also during this period. And I will also recommend a ECG at this stage. Now, what are the long-term effects? These are short-term, which will be seen within a year or 2 years. Sometimes they are prolonged. What are the long-term issues which are seen in menopause? They are very important. One is the heart disease. Heart disease, hardly you must have seen any female suffering from heart failure before 45 years of age. But now, as the estrogen is not available, which was cardioprotective, now there is time that you should go for a cardiac checkup also, because it affects the heart. Second is it makes your bones weak. In menopause, one is the aging, the other is the hormone estrogen. So you should take care about the bone health also. So there are different tests like DEXA which are available to see the bone health. Now, if there are symptoms, don't be afraid of going to doctor. Don't think that we are going to push hormones into you and which will have certain side effects. No. We will first recommend the plant products, phytoestrogen, which is usually known as. And then if the symptoms are so distressing that they are just not going, and for your benefit only, then only we will recommend certain hormones and in a recommended dose that they are not harmful to your health. So the end is that menopause is not the end of a feminine era. So enjoy your menopause, indulge in self-discovery, indulge in your power to change yourself. Thank you so much.